and they have them down here, so it really doesn't matter as long as we do it. I'm going to do hip next, so I'm going to take your leg, and I'm going to have my hand on her hip bone. Again, there's her hip is her iliac crest, her hip bone, where she flexes. So you're going to bring your legs, keep it straight, pull up. Now, one of the things is on your exam asks for you to do that straight leg raise, and then flex your foot, and you're looking to see, are you having any pain shooting down the leg? So that's one of your questions that they're asking you. But she has her leg flexed, and then she went down, and I'm going to bend your knee and flex, and then it comes back this way. And then I can take her, this way we're going to abduct and in. I can take her across a bit and down. And now you would do that on both sides. You can actually take the knee, you know, and move it a little bit back and forth, the hip, if you want to do it that way. But again, you're checking to see that she has no crepitus or that. You would do the same thing on the other side if they want you to do that, okay? Then to check for strength, I'm going to put my hands on your hips or your thighs. I want you to push up, okay? And then I'd be underneath, pushing down. I want you to try and push out, and then in, okay? So that's your strength and resistance on your hips. Knees. Again, you can do, you know, before you get, as you're doing the rest of the leg, you can do your temperature on the legs. You can inspect for any lesions. Of course, that, if I forget that, just that is to be part of your exam, is that you need to look at the skin in every one of these areas and, you know, palpate every area to see that you don't feel anything that's unusual along the way. So the knee, same thing with this. I'm going to bend her. Some people will put their hand in on the heel, and it makes it easier just to move around. So again, you can flex the knee, straighten the knee. Now this is where you feel crepitus, if you're going to feel it sometimes, is as they move a little bit. So you flex it and extend. That's our main movement with the knee. However, when she sits up again, I'll show you a couple other things. Some people will do, you know, our knee doesn't really circle, but you can kind of tell if people are having pain or discomfort by moving that leg around. But for our thing, it's a hinge, it's an up, and it's a down. Now when you do the strength resistance, you want her to try and push against your hand, okay, and pull back. But again, you're kind of supporting her knee. And then you would do that on both sides. Then you're down to ankles. Again, ankles are where you can at least get your hands on